Today is 26th of December 2019. This is the 11 years old female spay Jack Russell came with the problem of loss of appetite for about a week already.
And loss of weight also. Okay, so the owner suspect that the dog has pain in the mouth because he eats only soft food or dry food with water, but he wouldn't eat dry food like before. Okay, let's see. Yeah, it's very, very bad. You see the roots are exposed, huh? And there's the breakdown of the ligaments. Okay, how about the other side? Just have a quick look. Turn over. So now we are going to do dental. This is even worse. Yeah, turn out a bit even worse. And that is the reason why he doesn't want to eat and is losing weight. That's why the owner came here. Okay, this was referred by his friend to come here. So now we have given a low dose of sedation, and then after that we will crack the tartar first, and then after that then we will check the tooth whether it's loose or not. Okay, so this is basically under anesthesia, and what circuit is this, closed or semi-open? Open circuit, oxygen and isoflurane, yeah, 3%, huh? 2 or 3, what's the maintenance? Maintenance is 3. Okay, we put under 2%, no, not, how many percent is it now?
0.5.
0.5. It's very low because the dog is old. So we have this oximeter on, and then we'll check the pulse. We'll try to do as fast as possible so that the dangers of anesthesia should be minimized. Okay, we switch on the either that or we do it onto the skin. Okay, let's see. Starting.
Searching.